Hello and welcome back to Kaleidoscope after our long summer hiatus. I'd like to introduce you all to Dr. Chelsea Perry, a local dentist here in Westborough, who has a unique take on dentistry. Welcome. I'm so glad you could be here. Now, can you tell me how you came to be in Westborough?
A bit of a roundabout way. I went to dental school in Tufts in Boston. But before that, I grew up mostly in Vermont. After spending a little bit of time in the Midwest for my undergraduate education at Indiana, I knew I wanted to come back to the Northeast. So in looking at dental schools, Boston was the city for me growing up in Vermont. So I looked at all the dental schools in Boston, and Tufts was by far and away the best clinical program. And I knew, just from an early age, I knew I wanted to be in clinical practice. So that was the school for me. And then I had a great associateship out of school out in Leicester, Massachusetts. And this practice became available in Westborough. And I didn't really know much about Westborough beforehand. But in doing a little bit of research, I just found it to be such a great community that I thought, this is a great place to start my practice.
Wonderful. I'm an immigrant here from Connecticut, so we stayed in New England, but Massachusetts and Westborough are places that we finally settled. So it really is interesting. I want to go back to when you were younger. Did you always have a fascination with dentist teeth? Because, you know, the tooth fairy, I have to admit, I was terrified of that whole concept. I didn't want any little creature coming in and trying to take my teeth, because wonder if I didn't have a loose tooth, would they take one anyway? So I was terrified. So what was it like for you in deciding what career? Because this is a daunting educational journey, and it's a tough job to get into and getting your own practice. So what was early start to that whole thing?
I actually didn't have any dentists in my family, which was pretty typical at the time when I was applying to schools, that you had an uncle or a dad who was in the field, and I didn't know any doctors, dentists. But I knew early on, I was into math, into science. I knew I was going to be in some kind of healthcare because I knew I wanted to be with patients and just help people. That was just a way I knew I was going to go.
And that started when in your youth?
Probably middle school, high school.
Oh, right.
So in my undergraduate, studying biology, kept things open. Maybe medical school, maybe dental, maybe, there were so many avenues to go. And I had some dental experiences as a child, orthodontics, so I had been exposed somewhat to the dental world, but I never really saw it for myself until midway through college. I'd actually met a couple other students in one of my classes, and both of them had parents who were medical doctors. And they had given that advice to their children: whatever you do, don't go into medicine. And, well, why? Why wouldn't you want to be a doctor? Yeah. And they said just the lifestyle was just going, it was just going so differently for this generation, the generation I'm in, millennials. So I thought, okay, well, I want to own my own business someday. And is that an option in medicine? It's harder to come by small private practice, whereas in dental, that's still a thing.
Yeah.
So then I started looking into it more, and I shadowed some dentists, and I thought, okay, this could actually be right up my alley. And in dental school, you don't know if you're going to be good at something until you actually start seeing patients, which you start doing about 2.5 years into dental school. And so when I first started seeing my own patients in the clinic, I was like, this is great. I'm actually good at this, and I really enjoy it. So it was really serendipitous how I came into it, and I'm so blessed and happy that I found the perfect career for me.
That's amazing at such an early age, and that you kept that commitment, because there's that same as a doctor. There's residencies, and you have to do the background under supervision, and then you finally get your doctorate. Now, is it all right if I call you Chelsea?
Yes, please. Thank you.
We moved you now from childhood through to dentistry, and you have your own practice, but you're also a mother and a wife. How does that work out? Because one of your concerns, I'm sure, in what I read between the lines there, if you're a medical doctor, you have no time for yourself. It's 24/7 on call, and family life can be really compromised. But with your practice, how did that work out with the balance between wanting a family and having a practice?
Absolutely, it's a balancing act, no matter what industry you're in. But owning my own business, I did have that flexibility to have the time to have a family and to be there for my young children's milestones. Early on in my career, when I started my practice, I was 30, I think. And I thought, you know what, now's the time to work hard. I worked 6 days a week. I started my practice with 0 patients. And really put in the time and effort and to build something, from the ground up. And that was very rewarding. Took a lot of hours and, going in at 6 p.m. or whenever it was, weekends, but that really paid off because I got to really build my dream practice.
Now, you started out in a more traditional office, over by Staples, and you entitled your practice as an elite practice. What came up with that name? Give the full name of your...
Yes, we originally opened as Elite Dental Care. And I thought, what's going to be a descriptor for how I want to provide dentistry? What's going to really set it apart besides just calling it Chelsea Perry Dental, rather than naming after myself. What's going to open up opportunities to add more providers, grow this practice in the future. So giving it a name that wasn't my name was definitely going to be the way to go. But elite just came to mind as a descriptor of something that's, you're getting the best. You're not just getting regular dental care, you're getting the absolute best, and that was my goal from the start.
Well, it does strike you when you see it. And my curiosity, I actually went to your office when I moved here a few years back, and it was the traditional format of an office, and the practitioner comes in, and you have your teeth cleaned by someone else, and then you come in to check. And I was happy that it was a woman because I try to support women in business and in professional life as much as possible. And I was pleased with the service. And so then I saw signs that you were moving, and I went, oh my goodness, I just got the dentist I was looking for, and now you're going. So what precipitated the move to Main Street?
Well, I had definitely outgrown that space on Lyman Street probably a year or two before moving. We had just 3 rooms, and we weren't able to meet the growth and the demand, which is a great problem to have.
Yes.
So I knew it was time to expand, to bring on another provider, another hygienist, and just to be able to meet that demand. And this building came available. And
what is the address?
We are at 11 West Main Street now.
So it's
like
on West Main.
The corner of West Main and Milk Street, right on the rotary of downtown. And I thought, well, we've been kind of hidden away for all these years. We've still built up this great following and this great patient base, and to do that without really being visible. How do people find us? It was really just word of mouth, maybe online. But now being smack dab in the middle of town, it was a little daunting at first, honestly, because I'd spent a lot of time in Westborough, but being hidden away, you have a little anonymity, being right downtown, it was like, here I am. But now that I'm here, I'm so glad, and I just love being part of Westborough. So, yeah, moving down into the center of town was a great choice. And I was able to expand. Went from 3 rooms to 8. Added those providers, and we were really able to grow the business and the practice.
Now, we toured it earlier, and when I go there, I'm just on the floor where you clean and examine teeth. But the decor, we'll get a little bit away from the medicine for a minute, is very different and very, it evokes certain emotions when you walk in. As I said, I expected when I first went to the office that it would be like your other office, which was more traditional, white walls with paintings perhaps. But this was a real modern touch, and little things in it were intriguing. Like you have this large bowl that has a sand with a marble, and the computer runs the designs that the marble will make. So you're sitting there watching it do its little dance, but it's taking your mind off that you're going to go in and maybe hear bad news or good news or whatever. But it's very calming, and the decor has a an aesthetic that is very calming. And how did that? Who was that? Your decision? Did you bring in an expert to say, here's what you should do?
That was my vision.
Oh,
The aesthetic, kind of open concept, high ceilings, exposed ductwork, this sort of just open and airy. And this building really lent itself to being a blank canvas. So I really got to build it how I wanted it to look, how I wanted it to feel. I mean, even down to the way it smells. The smell of a dental office, it's awful. It's awful. And it evokes those memories of childhood, of maybe a trauma, you know, that we're really trying to help people get past. And I feel like one of our specialties is patients with dental anxiety, because we're creating an environment that doesn't feel like a dental office. That was super important to me when we were able to design it from the ground up, make it feel, smell, look, maybe like a spa or somewhere where you want to be.
but you had no background in business.
I really didn't. You don't get a lot of exposure to business training in dental school. It's all science, it's all medicine, and I love that aspect. But owning your own business, it really throws you into learning HR and learning taxes and learning things that you didn't know before. But trial by fire, we'll call it that. I feel like I've really learned a lot along the way. And one of the biggest things I've grown appreciation for is my team. Having people who support your vision and feel the way you feel about patient care, customer service, just the things that, I have a vision, but I need my team to execute it with me. And I feel really blessed to have the people that I have working with me.
And you have somebody working for you that you see 24/7. How does that work?
Yes, my husband has been with me all along the way. And if I am the scientist, the technician, he's the entrepreneur. And so we really balance each other in that way.
Oh, good.
He, helped push me to take the next steps in my career, and help me execute that vision of top-notch customer service, beautiful aesthetics, and helping me to see things from a different perspective.
In the 1950s, that's when I was going to the dentist, as a child, remember, that there was the dentist chair, and typically the male dentist came in, and there was this sound coming from other rooms, because I was fortunate enough to live in a city that used fluoride in the water. So I never had a cavity until I was in my 40s, right after I had so many children. I think my teeth started going. But that experience held with me from childhood. And so that's, I think, why I have this very emotional response to when I went to your office, because it was very calming. Each person was focused on me. When I walk in, the two women at the front reception part greet me by name. They tell me to sit down, and you're watching this little design going around, and there's water and coffee and things to make you feel well. But with our little tour the other day, I found out that there's many more rooms. Luckily, I don't need a lot of dental work, but now I found out there's rooms downstairs, there's rooms upstairs. So tell us more about how you went from dentistry to these other floors of very interesting health services.
Well, staying kind of on top of what's happening in dentistry has really led me into this idea of this whole body health, this holistic view of the body. There's more to it than just your teeth. It doesn't end just there. So I've been taking a more advanced training in dental sleep medicine. So that lent itself to starting a specific business for treating sleep. So we're treating sleep apnea, we're treating snoring, and helping people just generally feel better through laser therapy, oral appliance therapy, just things that are kind of new on the scene to help people with their overall health.
So just tell me a little bit how your teeth and your sleep might be connected.
One of the
Unless
things,
you were taking them out before you get.
one of the things we see with the teeth, and a lot of people, maybe from stress, but grinding your teeth, clenching your teeth, it's so common. And throughout my career, I've always seen it, but now learning more about how we sleep, and if we don't get good sleep, we can actually grind our teeth in response to that. So you may have this underlying condition of sleep apnea that is contributing to your dental problems, maybe acid erosion. Comes back to GERD, comes back to potentially sleep apnea. So this is all connected, and I can go in there and be a technician and fix the problem, or I can dive deeper and help patients find out what's really going on, and is there a way I can help them with that as well.
So now we have sleep apnea, and now I see the connection between teeth and acidity and difficulty sleeping and having and you work in conjunction with their dental work. That's how you first meet them. And then they come and say, well, I'm having trouble with sleep. And they go down to the sleep clinic. But then on the tour, I saw some things that were more less clinical, but also part of that whole holistic. And it was very intriguing that I had never seen before, that you have a facial massage and table and clinician to serve as doing facials. So how does that again connect back?
Back to your point about people who may have had a traumatic experience, or their concept of what dentistry is like leads to a lot of anxiety. And so in creating something where it's inviting, it's personalized care, we also have an esthetician as part of our team who can offer our patients a facial. So all of our new patients get a free 30-minute facial after their first visit. They can relax. I feel like it really just changes their perception and can really give them a new good experience to start building on, and just helps people with their dental anxiety.
And that's, again, giving them an idea of how you're going to serve them in the future. If you take care of the small, you're also going to be able to take care of the large issues. Because I'm sure your face has a lot to do with how you deal with your teeth. And the wrinkles or whatever you have is from how you hold your face together. I've never had to have braces. I was very fortunate. But that's another group that you don't see as many children as you do adults, or you have more adults than you see children, that you would do braces and that kind of medical treatment.
We do see the full range of ages. We see a lot of families. So we see the parents, we see the kids. Creating good experiences for kids is super important. Having their first experience with the dentist, we're seeing that at that young age. So we have this comfort menu for our patients as well. For the kids, it's usually pretty easy. You put something on Netflix, they're usually pretty happy. But for our adult patients, we have weighted blankets, aromatherapy, guided meditation, the ability to put headphones on, listen to some soothing sounds, or watch something on Netflix to take their mind off it, just to help them get into a good, calm state. I feel like that's been really helpful, and it sets us apart. We're really focusing on the patient's comfort, and it does help to let them know what we really care about. We're there to help them with their overall health, their dental health, because it affects so much. And honestly, dental avoidance is such a huge problem. Avoiding a problem obviously makes it worse. And if we can help people just get their foot in the door, get started on really tackling your overall health problems that a lot of times start in your mouth, I feel like we've made a huge difference for them.
Because your health is so dependent on your teeth. If your teeth are in poor shape, your diet changes, your appetite changes. So it's a real health issue, but we often put it off. But I don't. I have a standing appointment. I've learned for all those years when I didn't have any problems with my teeth, and then as you get older, things need to be checked on and kept up to date. But that was really something that is a holistic idea that is part now of in medicine, but it hasn't been integrated very often into the clinical side of general medicine. It's not as therapeutic, it's more therapeutic than holistic.
Right.
Now, let's go over to the room that I just saw downstairs. You said that you take care of patients who have missing teeth. So you do the normal dental work, traditional dental work, I shouldn't say normal. You do the massage for the people who are new. You do the children. But you also take care of, and I thought you were doing Botox for wrinkles. And I thought, now this I have to understand. I just don't see how Botox has anything to do with teeth. But what is that for?
Really, there's a big benefit to using Botox in the muscles that people use to over clench. Clenching, grinding, it's a huge problem. It does such wear and tear on your teeth that it helps with headaches as well, tension. But that's where the Botox comes into the dental world. There is a little bit of a cosmetic aspect to it as well, around the mouth, smokers' lines, things like that we can help with. We do some cosmetic things as well. But yeah, that's where the Botox and the dental kind of cross paths.
And so I passed that room and I said, okay, well, we'll keep going. And then we're down into the lower level, street level, and we come into this large room with, again, lying down. What's happening in that room that I was just stunned with what you were offering that was still part of the holistic and still had something to do with your training? What is
So
down there?
we've partnered with this business, Healthspan Longevity, and they're doing, blood work. They're doing more health screenings for, screen this carotid artery and look for blockages, look for plaques. Early detection, these things that are super important. We do the DEXA full body scans, looking for bone mineral density, looking at body composition, for people who are really looking to be more proactive with their general health. And there's a litany of other tests that they offer, and it fit really well into what we're already offering with the dental office and with the sleep practice, and now with this more medically focused business as well. There's just a lot more to offer our patients and other patients in Westborough who are looking for that.
And at the end of the day, you do implants, just because they're needed. And that is something that you do personally, or do you have another clinician that comes in?
Yes.
So you are again trained to that. That's almost surgical procedures, or I'm just assuming if you have to have another tooth inserted into your mouth. And that's another, you're not in the normal dental area. There's a special facility in this building for that, so that everyone feels secure and private, but yet getting the same quality care.
Yeah, and well taken care of. It was important to me to offer really all dental services that I could under one roof. The relationship between your dentist and the patient, I feel like it's so built on trust. It's built on, I'm looking out for you, and I want the patient to feel, especially when there's dental anxiety involved, that I can help them and take care of whatever it is they need with their teeth and with their overall health as well. If I can help guide them to the right provider, or if I can screen for something that's going on, there's something underlying, that's super important to me. But yes, the implant part took a bit more advanced surgical training, so that could be provided in our office as well. We take three-dimensional CT scans of the jawbone and make everything so surgically guided and precise and exact, so that they have really good outcomes.
Well, dentists are really an important part of the overall health of an individual. But they're often, again, if you're my age, baby boomer, we have this hesitation. So you're offering this holistic, gentle, elegant, elite services really is unique. And your entire staff, sans your husband, are women. And so, again, it's giving women opportunities to be in a professional field, and I just think that that is so amazing. And you're a great asset to the city, the little town here, and your work at Tufts gives you the credibility of someone who's academically strong, an entrepreneur, and a gentle person. And you're there, you know, you're the people that work on me. I don't know my left from my right, and they always remember, and they'll say, look away, look at me, look away. Because when they say turn left, I'm going, okay,
Which way? Somebody else.
So those little things make a difference to me, because I don't feel silly then that I can't follow the directions. So tell them thank you.
Isn't it funny that the simplest little things
Yes.
can make a huge difference?
Yes, and you do make a huge difference. So thank you so much for joining us. It was wonderful to have people hear your story. And how old are your children? We have to give a little shout out to them.
They're 9 and 6 right now.
Okay, very good. Well, they'll be bringing home a Kaleidoscope to them. So thank you again for joining us on
Thank
Kaleidoscope.
you so much.
Take care. And thank all of you for joining us today on Kaleidoscope.